Right now we have Dr. Turner Vossler on from JOI, so apologies. I couldn't hear Casey talking to us, Doc, but good to have you on and good to spend a few minutes with you from Jacksonville Orthopedic Institute. Boy, Achilles injuries in the sport of football seem to be a big thing, all centered around Aaron Rodgers. We mentioned this a couple of weeks ago. Can you give us any insight? Do you know kind of the sped-up version of what they're trying to do with Rodgers now that you've seen some of that explained away?
Yeah, for sure. Well, first of all, thanks for having me. Yeah, I mean, Achilles injuries historically were really difficult to overcome, primarily just because it just takes such a long time for the strength to return. And that's really what the issue is, especially with the quarterback where, when you drop back and you got to be able to push off with good strength to get, fire the ball downfield. The concern is just whether he's going to be able to get all the way back there. I think that the surgery that he had. So it's interesting. So the way that we repair these has changed over time.
Yeah, it seems like it.
Yeah. So historically, we made a big open incision and just tied the two ends together. And over time, we tried to go to smaller and smaller incisions. And then sometimes we'll actually put sutures up on the top end and then put it into some bone anchors that we put down into the heel bone, which is at least based on what's in the popular press, it seems like that's what he had. And there's some advantage to that potentially, just because it is a little bit more secure potentially. But the surgery is one half of it. The other half of it is the rehab, and the rehab's equally as important as the surgery. It's interesting when you look at the history of how we've done that, because for a long time, people wanted to try to get people back, more quickly. And so we were more aggressive with the rehab, really try to get them stronger, quicker, work on strengthening. What we've learned over the time is that may not be the most beneficial thing, that we've actually gone to more of a slowed down protocol where we try to really focus on maintaining the tension of the tendon. And we've had some success with that, here, and in my experience, that's kind of where most of us go. So it's interesting to listen to people talk about really trying to, push it. And he's like saying he's going to get back for the playoffs, although, we'll have to see if the Jets make the playoffs. But yeah, I mean, it'll be interesting to see how he does.
Yeah, it's just fascinating. I feel like some of the high-profile Achilles injuries have brought this specific injury to the forefront. We almost are now numb on like an ACL injury. We've heard it so much around sports and even seen recovery. We can almost tell how long that's going to be recovery-wise, how guys come off it. But most recently with Kevin Durant over the last few years, and now Aaron Rodgers, and even here at home, DeJuan Smoot, James Robinson for the Jacksonville Jaguars. It just seems like it's kind of in our face and in our minds with the Achilles injury. And speaking of that, DeJuan Smoot has worked himself back. He's a guy that could be back in the next 3 weeks. We'll see what happens as the Jags get him off injured reserve. I guess the question I have around a player returning from it, you were just speaking to this with Aaron Rodgers a bit, is once you get cleared or once you recover and you did all the work, is there another big step to kind of get back to where you are as a prime athlete and feel comfortable with all the recovery and what went on?
Yeah, so it's very different than some of the injuries. I mean, obviously ACL is one of the big ones that we talk about with the athletes too. But the primary thing with the Achilles is really just strength. I mean, for reasons that we don't really understand, people just get profoundly weak after this injury. And obviously, a professional athlete has everything kind of optimized from a recovery standpoint, but it still remains true in those guys. And so what we follow, with all those guys is just trying to get the muscle working like it's supposed to. So I was actually in academic practice for a while, and it's funny because one of the big studies that I did was on return to play and performance after Achilles tendon rupture, and sometimes it gets dredged up when you have injuries like this. And so that was a fun study because it was like a scientific publication, but it was mostly on fantasy sports statistics. But we looked at primarily NFL and NBA players, and for some of them, it's hard for them to come back. I mean, they just never really get back to 100%. But of the ones that did, it was really the second season after they came back that their statistics were kind of on par with what you would expect for them, which suggests that it can take sometimes a year or sometimes even longer for people to fully get back from it. That we published that in 2017, so that was really on people with Achilles ruptures out to 2015. And I think the rehab has changed a little bit since then. And so I think with a motivated patient, I think 6 months is really the number to get people back. So although Cam Akers for the Rams came back a little earlier than that, although he hasn't been super successful since then. So I don't know if that's related or not. But
you mentioned, sorry to interrupt. You mentioned the strength. Is that strength in the actual foot, ankle area, or is that strength almost in the lower half because you can't train to the way you want to?
Yeah, it's really just strength in the calf muscle.
Okay.
So obviously for all these guys, that's really important to have that burst and power and everything that they need. And so when the strength's not there, people are pretty limited.
Yeah, that makes sense. Dr. Turner Vossler with us from JOI. We're talking, he specializes foot and ankle, and we're talking a little bit more about the Achilles injury, which has become pretty prominent in the NFL this season. I did want to ask you about Joe Burrow, and I hate to put anything on him. It's just that he's nursing a calf injury, and I know there are other, people will tell you, I think, people will tell you differently. You can tell us, but I think I've heard in the past that, let's just say an ACL injury, sometimes that morphs into an ACL injury because maybe the hamstring isn't as strong or something like that. I feel like I've heard that before. With the calf, if you have a calf issue, could that potentially be a little bit of foreshadowing to an Achilles injury?
Well, they're certainly related. Basically, there's two muscles that come together to form the Achilles tendon, and people frequently injure, one of those muscles. We see it a lot. It's actually paddleball is crazy. It's like an epidemic out there. But anyway, so it's probably not true though that would potentially lead to an Achilles injury. But that's not to minimize it as an injury, especially for someone who's a pro athlete who's doing it all the time. Just because he uses that muscle so frequently, and once it gets injured and you're in season, it's really hard to get it to completely go away. So it's a lot of times just people have to kind of work their way through it as best they can. So I suspect that's probably something he's going to be nursing more or less most of the season.
One last one for you, Dr. Turner Vossler with us from JOI. You can see him in the San Marco Clinic, by the way, and hopefully you don't have to see him, but definitely see him if you have any foot and ankle issues there at Jacksonville Orthopedic Institute. Doctors join us each and every week right here on Brent and Friends on ESPN 690. Brent Martineau, Aaron Schachter, Casey Kurtz here on this Wednesday. How much of the recovery, everything you're talking about, from the Smoots to the James Robinsons to the Aaron Rodgers to everybody who's doing this, is the athletes are just, as athletic as they've ever been and finely tuned as they've ever been, so the ability to get back lies with them? Or how much of this is you're studying modern medicine kind of helping them get back sooner and sooner?
Well, Brent, as a surgeon, I'm definitely going to take all the credit. So,
good idea.
That's how we do things. No, it's funny when you talk about, because obviously there's a lot of high-profile athletes that have had Achilles tendon ruptures in the past. Kobe Bryant, Kevin Durant, you said, and Aaron Rodgers. And the one thing that is hard to quantify for a professional athlete is their will. Because a lot of these, you look at these guys in the NFL. A lot of them are fairly gifted athletically. But the guys that really achieve at a high level are just not going to let themselves fail. And so I think as a surgeon, obviously those are people we love to take care of because they're going to, put in the work and do whatever you ask them to do to get back. And, when we looked at it objectively, that's the one thing that's just hard to quantify that I think really plays a large role here.
Yeah, there's an intangible or two when it comes to the professional athlete, different than maybe the normal patient. Totally understand it. Dr. Turner Vossler at Jacksonville Orthopedic Institute, specializing in foot and ankle. Appreciate all the conversation as it pertains to the Achilles injury, and we'll talk to you down the road. Have a good day.
Thanks so much.
This week's Injury Update is brought to you by the Jacksonville Orthopedic Institute. JOI is the official sports medicine provider of the Jacksonville Jaguars.